Thank you, Tina. Good afternoon, everyone. We have no new cases of COVID to report, no deaths, and there are no active cases in our long-term care. This is a good day in Nova Scotia. It's also an important day. I am wearing a red sweater, and there's some red peeking out of Dr. Strang's raptor tie. Today is Stop the Violence Day. The day was created by Quintrell Provo, a leader from our African Nova Scotia community who has set a great example for all of us. And I encourage all Nova Scotians to support the fight against racism today and every day in our province. Now back to COVID-19. COVID-19 has been hardest on our seniors living in our nursing homes. And for families visiting loved ones through the window or on a screen, we understand it has been lonely and difficult, but it has been necessary in order to reduce the number of cases and to protect you. It's worked. Our cases are down. Dr. Strang and I feel it is time to ease some of the visitor restrictions in our long-term care homes and homes of people with disabilities that are funded by the Department of Community Services. Effective Monday, June 15th, visits can resume, but they must happen outside, and visitors must stay 6 feet apart. There will be additional measures in place to keep residents and staff and visitors safe, but Dr. Strang will outline those measures in a moment. And I know this is not exactly what you were hoping for, and we understand you're craving for that long-awaited hug. We're not there yet, but sitting in the fresh air and a visit with your loved one is a good first step. And if we properly do this and keep everyone safe, we will be able to get that hug when the time is right. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. As I mentioned yesterday, the public health team has been working to reconcile and consolidate multiple data sources to ensure that all the publicly reported data comes from a single source, which is our electronic information system, Panorama. That work is now complete, and our numbers today reflect that work. They're the most up-to-date and comprehensive COVID-19 data, and we've resolved all the discrepancies that people have been pointing out in the last number of days. I just want to point out that these changes have altered a few data points, so I want to go through those so people are clear on those. As the Premier said, we're not reporting any new cases of COVID-19 today, which is good news. But our total case count has actually increased by one additional case, and that reflects a Nova Scotian who tested positive for COVID-19, but that individual doesn't currently live in the province and wasn't tested here, but because of the way we report things between provinces, they are reflected in Nova Scotian numbers. So that brings the total number of confirmed cases to 1,061. The recovered category has been named resolved, and this more accurately accounts for all the COVID-19 cases whose investigations can now be considered completed and closed by public health. And lastly, the breakdown of total numbers of cases by location is now based on the health authority zone that the individual lives in, not where their sample was collected for testing. And that's actually a more accurate representation of the geographic nature of where COVID-19 cases are occurring. So currently we have 46,668 Nova Scotians who've had negative test results. We have 1,061 positive or cases that are positive for COVID-19. Our total number of deaths is 62, and we now have 994 cases that are considered resolved, and that leaves us with 5 active COVID-19 cases in the province. We have 2 individuals who are currently in the hospital, both of those in the intensive care unit. And the QE2 lab yesterday again processed a significant number of tests, 691. And as the Premier said, that I'm pleased to announce that there are no licensed long-term care homes, including Northwood, which have active cases of COVID-19 in either residents or staff. While this is all good news, that our new and active case numbers remain low, we must remain vigilant. We introduced a lot of changes within the last week, and it may take a couple of weeks to ultimately see the impact of that in terms of the epidemiology. So we have to be watching things carefully, and we need to keep our eye very closely on how things are evolving. It's important that we sustain for not just for the next couple of weeks, but all the way through this new phase of COVID-19, and certainly through the summer. We need to maintain a strong capacity around testing Nova Scotians, having a low threshold for testing, making sure they have easy access to 811 to get screened, assessment centers, and then maintaining capacity in the lab, as well as the public health capacity to rapidly follow up cases and contacts. And again, I want to remind Nova Scotians that if they are feeling unwell, that they could think about going to the 811 online assessment, looking at those symptoms there, and going through that, and then they'll get further direction whether they need to then actually call 811 and go into testing. But if you're feeling unwell, then certainly a good step would be to do the online assessment. As the Premier's talked about, visitor restrictions are being loosened as effective of next Monday for those in long-term care homes and homes funded by the Department of Community Services under the Homes for Special Care Act. I know that the last few months have been particularly challenging for residents in these facilities as well as for their families. I can only imagine how hard it is to not have been able to see your loved one, your family member who lives in a residential setting. Very challenging indeed. But we know that there is more risk of the virus spreading in places where people live together, and certainly in long-term care and some of our Department of Community Services homes, there are many people with underlying health conditions that puts them at significantly increased risk. That is why we need to proceed very slowly and carefully as we start to allow visiting to happen. We need to take it one step at a time and watch the impact of each step along the way. So as a first step, we are going to be allowing outdoor visits, and that is a way to start to allow residents and their friends and families to get back together safely. There will be several measures to be put in place to ensure that we have an appropriate level of safety even as we start to allow visits. So the visits can only happen outdoors in designated areas, and each facility will define what those designated areas are. We're starting with only 2 people can visit a resident at once. The visitors must stay the physical distance or at least 6 feet or 2 meters apart from their family member or the resident. Visitors will be asked to be screened, so they'll be asked whether they go through the list of symptoms that could be COVID-19, and anybody who says yes to any of those symptoms checklists will be asked to not visit until they've gone through appropriate further screening and testing if necessary. We're also asking that any visitors wear the non-medical mask, and certainly anybody that's sick in any way, feeling unwell, should not even consider going visiting, even if you may have a scheduled visit. It's just too risky. We will also be tracking the information, so visitors, the date and time that they visited, their contact information, and that's simply that if we do have a case, it facilitates public health follow-up, knowing who might have been in close contact, and makes it much more, we can have much more timely contact of potential or contact with people who might have been exposed to COVID-19. And all the visitors will be monitored and overseen by staff. That this is the minimum set of requirements that we're putting forward from public health to the continuing care sector, but individual facilities may put additional protocols on top of that. We're certainly we're respecting their wish if they want to go further and have increased levels of safety that can absolutely do this. So again, this begins effective June 15th, but I think the public needs to understand that some facilities may not be ready by then. So it'll ultimately be up to each facility when they feel ready and comfortable to start allowing visits to happen under these criteria. I know that people have been waiting a long time for this. I've certainly had a lot of correspondence, and I fully understand the anxiousness and the desire that people have to reconnect. And I'm pleased that our epidemiology now shows that we're in a good position to start to relax these restrictions on visits. But again, we need to do that carefully. In closing, I just want to say some people may have noticed I'm wearing a Toronto Raptors tie today. That's in honor of our celebration. It was 1 year ago this Saturday that they won the NBA championship. Lots of people, I'm sure, remember that. It seems like the entire country came together, was rooting for our home team, whether they were basketball fans or not. I know my household with that. They're not all basketball fans, but we all were watching and jumping around. But I use that as an example because I think this is, we've been through challenging times with COVID and other events in Nova Scotia. And what has really heartened me and really strengthened the work that I do is seeing how Nova Scotians have come together again as a community, looking after each other through the last few months. But it's important that we maintain this, that we continue to stick together, to come together as a community. Our reopening and our ability to stay open will only be successful if we continue to work together, think of each other by caring about each other, by thinking positively about how we create positive, engaged, and supportive communities, and ultimately each of us using our own common sense about how we apply the public health rules and requirements that we can keep each other safe. We have stuck together in the last few months, and we need to stick together as we go down this road of recovery from the first wave of COVID-19. Our strength is in our community and our collectiveness, and we really need to continue to focus on that. That's the way forward. Premier.
Thank you, Dr. Strang, and Tina will be happy to answer any questions.
Just a reminder, we'll take one question, one follow-up from reporters on the phone in the allotted time that we have. We'll start with Graham Benjamin from Global. Go ahead, Graham.
Hi, thank you. Just had a question for Dr. Strang there. I did see that the language had kind of changed from going from recovered cases to resolved cases. Just wondering if you can speak a little bit more in depth to the rationale why that language changed. And I did notice that number kind of went down. I think it was 999 before. It's now 994. So if you can possibly just speak to that.
So, I mean, the language is really coming from public health. So recovered really applies to somebody to meet the criteria that they have recovered from COVID-19. Resolved really means that they've recovered, but also the work by public health to make sure we finished all our follow-up, and they can consider that the case is now, they can essentially sign off on the case. It's no longer an active case by public health, and that's why we've changed that language. The change in the number would actually be that we have had the number of 4 cases which were considered they have recovered, but they hadn't been fully finished and signed off by public health.
Go ahead, Graham, with your follow-up.
Thank you for that. And I did also want to ask about just the active case number. It's at 5 right now, and I'm just wondering, I know this was mentioned before, but now all the data is in one source. Is that active case number going to be regionalized at any point, or is it still going to be just a cumulative number across the province?
Well, we're actively looking at, actually, we fully expect that the number of active cases, most of those are getting close to where we can actually have them resolved. So we feel that there's other areas that, this was a piece of work that we needed to do that we're very hopeful that soon we're going to have no active cases at all in the province. And then it's a moot point about breaking it down by geography.
Next, we'll go to Preston Mulligan from CBC. Go ahead, Preston. Preston, are you there?
Yeah, sorry, this is Preston. Question for Dr. Strang. So for visitors who want to visit family members at long-term care, how is the decision made which residents might qualify for a visit? I mean, is there a bar that must be met as far as their own health?
No, that's up to each facility. I think we're whatever. If people, if their family wants to visit and the visit can be arranged at a long-term care facility, there's no kind of level of health status that needs to be passed. Each of these members each of the residents are part of a family, and we're not going to get in the way. We want to facilitate as much as we can while doing it safely. The opportunity for residents and their families to reconnect. And we feel that with the steps we have in place now, with maintaining social distancing, masking of visitors, that even if people may be very frail in their health, that the appropriate safety is in place. I also think it's important we understand that not having connection has its own negative health impacts.
Go ahead with your follow-up, Preston.
All right, this is also a question for Dr. Strang. It's regarding the large gathering on Spring Garden Road last week during the protest. Can you tell me whether there's any kind of strategic testing happening to find out whether there was any transmission, or maybe there was zero transmission, whether anyone at Public Health is focused on that event and testing and finding out whether there was transmission and what kind of data you can take away from that event?
So our focus is going to be, if any new cases come up, as I've said previously, we always ask people where in the time frame where they could have been exposed, in the week to 2 weeks prior to their onset of their symptoms, we get a detailed history of where they were and what they were doing. One of our questions is certainly going to be, were you at a protest? And if we see that popping up, we'll have to do some more work. So that's how public health is going to follow. We'll do it as part of our case follow-up. We don't have any proactive plans to be looking into this. We don't know who was at that, we don't have names and contact information. I do know, however, there is a research proposal by colleagues at Dalhousie University to do exactly this. I don't know where it's at in terms of being finalized, but they were putting together a research proposal to get people who were actually to come forward to volunteer, people who have been at at one of these protests, to come forward and be monitored on an ongoing basis. That kind of work it needs to be done with the resources available under a research protocol. It's not the kind of capacity that public health has at our fingertips, but we are certainly going to be paying attention to the possibility of any of the protests being a source of exposure as we do our case follow-up.
Next, we'll go to Nick Moore from CTV. Go ahead, Nick.
Thank you. Just to clarify for any Nova Scotians who are, interested in making that appointment to see their loved ones in a long-term care home now, should they be calling these long-term care homes themselves right now, or is there an organized way that you'd like this to kind of roll out in terms of how the families contact and make those arrangements?
We're leaving that with each facility to organize and with their families. I would ask Nova Scotians to be a bit patient, because I think a lot of the facilities are planning on reaching out. I mean, they know who the family members are and they have contact information. So we don't want to flood our long-term care facilities with lots of people contacting them. So I would ask Nova Scotians to be a little bit patient. You will, in all likelihood, hear in the next few days from, if you have a family member who's in a long-term care facility or one of the other facilities we've talked about under community services, you will be hearing in all likelihood from those facilities about what are the steps to take to actually make an arrangement and have a specified, if you will, an appointment, because they need to manage. They can't have everybody just coming in all on the same day. So they're going to have to establish processes for people to make a date and time to arrange to have their visit.
Go ahead, Nick, with your follow-up.
Thank you. And just with the Panorama data system kind of coming online today here in Nova Scotia, can you say why it has taken 3 months for this to come into being here in Nova Scotia, and also how much at the end of the day will this cost?
So there's no cost to this. I mean, this was, the cost of Panorama. I don't have those figures at hand, but this final link, the final step of linking the lab information system with Panorama was part of the plan of the implementation of Panorama all along. It was one of the final steps. We got sidelined by the response to COVID through March and April. We were finally able to do that linkage. The information technology folks were able to do that linkage. The reason it took from April till now is I have a team of 3 epidemiologists who who are working 7 days a week to do all the basic epidemiology. So I think we have to have some reasonable expectations of the time frame that they've had and the other things they've been doing to be able to then do all the background information to look at the linked data to make sure it's accurate, make sure everything is working, and then do the corrections. It may sound easy, but there's a fair amount of work that actually has to happen to do that. And a very busy and hardworking team of 3 people, they were able to do it in the time frame that they were given everything else they've been having to do.
Next, we'll go to Cassandra Nadeau-Lamarche, Radio Canada.
Hi. Regarding the visits, will there be a time limit that is going to be established, or is it something that the individual homes will have to establish?
That's up to individual homes. I think it's important to understand that we're leaving it to homes to do a lot of the, I guess, in the managing the details of how visits will occur. We've put parameters in place that we feel are necessary to have for visits to be done safely. Beyond that, as long as those parameters, safety parameters, will be met, it really is the facility's responsibility to work out all the details, and understanding that there's a lot of other things that happen every day in a residential care facility. So again, I asked Nova Scotians that I know they want to visit their relatives. We want you to be able to do this, but we need your patience for these facilities to be able to manage this on top of everything else they're doing to care for all of the loved ones that are under their care in their facility.
Go ahead, Cassandra, with your follow-up.
Yes, this is again for Dr. Strang. So you may have been made aware that in Quebec there was a letter that was written by a dozen physicians that asked the Premier to ease the restrictions around children, arguing that the mental toll on children is going to be bigger than the health risk. So could that information be taken into account by easing some of the restrictions around daycare, schools, and day camps?
So I'm aware of that letter, and it's absolutely one of the factors that we're taking into account. As I've said all along, that this is about a balance. We need to continue to respect the safety necessary for COVID, but all the very tight restrictions have their own set of harms. I've said that many times: physical, emotional, social, and financial harms. And you're absolutely right around the impacts on children. So that's part of the thing we're taking, and we have to be thoughtful about how restrictive we make environments, even when we do open daycares, when we do open schools. It's all about finding a balance, respecting the need for safety with COVID, but also respecting the need that children need to be in environments that they can grow and thrive in.
Next, we'll go to Stuart Peddle from the Chronicle Herald. Go ahead, Stuart.
So I'm wondering about the time frame of how long the first initial restriction relaxation things will be in effect. As opposed, if it goes through smoothly, there's been no further indication of any infections, when they may be even further relaxed, that people may reach that point where they can hug their loved ones.
So those restrictions are based on, we have to say, what is the likelihood of somebody from a community coming in to a long-term care facility. We know that I've said this previously, that we opened up a large number of businesses on Friday, all of which by necessity but they do increase the potential for some transmission of COVID-19. We've also had protests last week and ongoing that, again, some level of risk. So we need to be watching things for at least the next 2, if not 3 weeks, so which takes us to the end, towards the end of June. So my hope is that we continue to have very low and stable epidemiology, and then we can start to look at a whole range of things being further relaxed, including what the next steps might be in terms of visitation in our residential care settings.
Go ahead, Stuart, with your follow-up.
The follow-up is, again, regarding time frames. In this case, with media, wondering when it may be possible for media to actually have an in-person press conference with yourself and the Premier. I know it will depend on data for health epidemiology, but it seems that a freedom of the media press would indicate that more give and take in a person-to-person situation, of course, with safe distancing.
Well, I mean, my job is to make sure that I'm giving advice to the Premier based on public health. So like many things, we'll watch what the epidemiology brings. I can't say it enough. The next 2 to 3 weeks are critically important to see what the impact of our first steps in recovery have been. And that's why it remains critically important for Nova Scotians to continue to pay attention to, as we've created both business and retail and other community environments that you can return to, it's critically important that you continue to respect the needs for staying home if you're unwell, maintaining social distances, careful washing of your hands. It's that collective, what I said earlier today, collective concern about each other, which will allow us, give us the best opportunity to not allow COVID-19 to gain a foothold and continue down this road of recovery, including what you're talking about, the opportunity to start to remove some of the virtual ways that we connect with each other, including the media. But I can't give a timeline on that, and I'll give my best public health advice when the time is right to the government.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, in reference to the plan Tim Houston submitted to you for reopening and resuming standing committees of the legislature, do you see any issues with the plan he's proposed?
I've only been sent the plan today, and it's a plan. I'm focused on reviewing plans. Any business or operation that was ordered closed under my order, that is what I'm focused on, reviewing plans and making sure they have safe plans to reopen. The legislature wasn't closed down under my order, and I'll be responding back to Mr. Houston in that effect. It's not up to me about that's a government issue, and my focus is on, again, around reviewing plans that were ordered closed under my order.
Lindsay, go ahead with your follow-up.
Thank you. It's been more than 2 weeks now since some medical procedures that were halted have been allowed to start back up, first with short stay and day surgeries. Do you have an update on progress on completing canceled procedures? And I'm still hearing from reports from people who are in pain as they wait for surgeries that require longer stays. How much longer before more significant procedures can resume?
I don't have an update on that. I know that work is continuing. I think it's best if you go that directly to either the Nova Scotia Health Authority or the IWK, who have all the details on how they're bringing all those range of services back online.
Next, we'll go to Katie Hartite from News 95.7. Go ahead, Katie.
Thank you. Yesterday's reported death happened weeks ago, but was under investigation. Are there any other deaths that you're aware of, Dr. Strang, that are similarly being investigated?
None that I'm aware of. I was aware of that one, and I was waiting for the results, but I am not aware of any other deaths that are under a similar investigation.
Go ahead, Katie, with your follow-up.
You've touched on last Monday's protest downtown Halifax, and in the last few weeks we've seen more large public gatherings, including Black Lives Matter events, but also funeral processions for members of the armed forces. At this time, have any confirmed COVID-19 cases in Nova Scotia been associated with these kinds of crowds?
Not to date, no.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thank you. In terms of reopening the economy, with you guys enlisting business associations to come up with a hygiene guideline and communicate the information out to the affected businesses and the sector, where exactly does the buck stop? If someone has a concern about how something is being handled, is the government responsible or is it on the business association?
So there's a set of, all businesses are meant to required to operate under requirements for occupation, health, and safety, require a safe work environment. All those we've added a layer of COVID-19 safety to those standing occupational health and safety environments. So there's that, but ultimately the responsibility is for the business or the whoever runs the workplace to make sure they're providing a safe work environment. We have inspectors in other types of licensed facilities, restaurants, bars that are also they're looking out for the COVID safety protocols, if you will. But ultimately, a lot of this really sits with the responsibility of whoever is operating, whether it's a business, a workplace, a community event. They're the one, we give them the protocols under which they have to operate, but they're the ones responsible that have to meet those protocols and are responsible if something happens and the protocols have not been met.
Go ahead, Kyle, with your follow-up.
Okay. Also about reopening, but now looking at the anticipated second wave of COVID infections. I'm looking at the current state of opening with businesses using the hygiene routines and physical distancing precautions and so on. If a second wave comes, is your expectation that we could safely carry on at this state of cautious opening, or would we have to go back maybe to a more lockdown situation?
Well, the anticipation is that as what we're learning through reopening, that there's been a number of steps put in place, and as we've talked a lot about, part of our new normal is all these things that facilitate social distancing, advising people not to come in if they're sick, on and on, increased opportunity for hand washing. Those are part of a new normal and have to be sustained, and are part of what will help us to minimize the impact when a second wave happens. But also that we are, when we had to act very quickly back in March, and we kind of put the brakes on very hard and shut things down by necessity. We've learned a lot from that. We know much more about the virus. We also know through our as various sectors are building their reopening plans, many of them have different stages and steps in them. So the hope would be that if we start to see a resurgence, first of all, we have the surveillance in plan that we need to continue, that we can detect any increase early on, and then if necessary, we can take a much more focused and targeted approach, whether it's based on a limited geographic area, or whether it's based on one type of business that we have to take back one or two steps in the recovery plan. So that is the anticipation, and that's what we're working towards. But if we absolutely had a huge resurgence and had to go back like we did in March, I would be advising that we do that. But the hope is that with earlier detection and with build on our experience and knowledge, we can have a much more nuanced and targeted kind of approach to limit spread.
Next, we'll go to Bill Martin from Six Rivers News and Radio. Go ahead, Bill.
Thank you. For Dr. Strang. Dr. Strang, people have wanted to know since day one on a county-by-county basis what they were up against. And you've been steadfast saying that the numbers in some cases were so small, it might open the door to breaching confidentiality problems and issues. Is it not possible for us to take a look at the historical numbers now and just refer back to how many cases there were county by county?
That's something we can consider, and looking back just for historical sake. The reality is that my team has been working very hard for going on 4 months now. My first focus is when we get a bit of breathing time, is actually allow them to have a rest. Maybe sometime in the future we'll be able to do some of that historic look back for interest's sake.
Go ahead, Bill, with your follow-up.
Just to make the comment that I think there is a very real desire in the public to have that information. Thank you.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina, and thank you, Dr. Strang. You had a full afternoon. Well, you did well. Dr. Strang and I have made some decision about what the next couple of weeks will look like. And before we get into the details of that, Dr. Strang has some information he'd like to share with Nova Scotians.
So I think it's important Nova Scotians know I have to go tomorrow. I need a relatively minor surgical procedure. I have a minor type of skin cancer which is diagnosed. It only spreads locally. It's been removed, but I need another type of surgery that just can relook at things and make sure the margins of where it was removed are clear. That type of surgery is not yet available in Nova Scotia, so I have to go to New Brunswick for a minor procedure tomorrow, which means, like all Nova Scotians coming back into Nova Scotia, I'm no different than anybody else. I have to follow the rules of 14-day isolation. So I'll be on 14-day isolation. It doesn't mean I'm not going to be working. I'll be working from home, but I think because of that, it's also an opportunity to focus on looking at the epidemiology and planning for the summer and into the fall.
It's a great example of practicing what you preach. I believe and I know, as well as all Nova Scotia do, Dr. Strang is without a doubt an essential service in our province, and he's done a tremendous job helping guide us through the last number of months. But his decision to self-isolate shows his integrity and how much he cares about the health and well-being of Nova Scotians. Dr. Strang, on behalf of all Nova Scotians, I wanted to wish you well, and I look forward to seeing you. It's going to be pretty strange. I've seen you so much in the last 3 months. Now just to hear your voice over the phone. While Dr. Strang is working from home, we've decided to take a break from these briefings. We won't be seeing one another in person, but like every day, Dr. Strang and I will continue to be talking and working on the next steps, what the next steps of opening up our province look like. The next weeks, though, are critical. We are testing and monitoring as businesses are open, and the incubation period for COVID is about 14 days. So we don't know for the last 2 weeks if there has been any spread within our community. We also have daycares opening on Monday. They are limited in capacity, but kids are coming together for the first time since COVID started, and we will monitor how that is going. We will provide updates in the case numbers every day, online, and news releases. And if there is a spike or a sign of trouble, we will be back here with the use and help of technology. Obviously, we hope that doesn't happen. We seem to be moving in the right direction, and we can't stop now. Please continue to follow the protocols. Keep your distance. Wash your hands. Wear a mask when you feel is necessary. Don't go out if you are feeling sick, but if you are feeling good, get outside. And don't forget, think local, buy local, support local, stay safe, stay strong. We've got this.